Welcome to this Recovery Boost Capability Building online training session, presented by the Social Research Centre on behalf of the State Insurance Regulatory Authority.
Bringing your evaluation together. This session will cover developing an evaluation plan, what are the questions you want to answer, establishing outcomes and measuring success, and evaluation reporting. We're going to explore how to bring an evaluation together by developing an evaluation plan. An evaluation plan provides a useful structure for the overarching approach to evaluating your project and demonstrating success. We noted in the glossary that an evaluation plan might have different names or terminology, such as framework or strategy. We are referring to a plan for the purpose of this webinar. Broadly, evaluation plans typically include the questions the evaluation is seeking to answer about the project, the outcomes and measures the evaluation will use to assess whether the project met its aims, and the methods that will be used to collect and assess the information. For example, this could include the use of surveys, interviews, existing administrative records. Let's consider the questions you might want to answer about your project. Evaluation questions provide a means of focusing an evaluation and working out appropriate ways to measure success. The questions can be drawn from the overarching aims of the program, such as the Recovery Boost aims to improve health outcomes for people managing mental health issues at work in New South Wales, or the aim of your own project. Let us use the Regional Council case study example to consider some possible evaluation questions. In the session on designing your project, we suggested the project aim could be to support staff in their mental health recovery by increasing their self-esteem and promoting positive interactions with other council staff and the public. Here, we have suggested 4 example questions to address this overarching aim. Does the project improve interaction between staff with disabilities and mental health issues and other council staff? Has the project resulted in improving confidence of staff with disabilities and mental health issues to interact with members of the public? In what ways did the project improve mental well-being of parks and garden staff with disabilities and mental health issues? And did the project change the council work environment related to inclusiveness for all staff? How do we assess whether the project is successful? This relates to some of the concepts presented in the project design session about measuring success and how to develop project outcomes. Outcomes generally have clear high-level statements that represent a desired result of the project. Begin with the end in mind. What's the goal you hope to achieve through your project? Outcomes can be reflected in short-term, medium-term and long-term categories based on when they are likely to be achieved. I will touch on this again shortly. Measures are used to assess the extent outcomes have been achieved. By this, we generally refer to numeric, quantifiable metrics. Some common measures include numbers, for example, the number of confirmed COVID cases in New South Wales. This is an example of a common measure we are seeing reported regularly at the moment. Proportions. Another example measure is the proportion of New South Wales cases in Australia, which gives a sense of the share of a total population. Note that multiple measures may be used to assess success of the same outcome. And finally, data sources. These are used to provide evidence for the measures. Measures can be drawn from existing information, such as administrative data. This is typically data that is collected routinely as part of the delivery of a service. For example, A hospital collects data on all patients that are admitted for care, including information about the patient and about the hospital service provided. Or often new data might be needed, which is collected specifically to determine the measures required for the project. This could include introducing new surveys or conducting interviews to gather new information for the purpose of the project. Outcomes, measures, and data sources are all really important elements of an evaluation plan. We will touch on our case study example again here to demonstrate how we might measure success and think about where the data could come from to determine the measures. One of the example outcomes we introduced in the session on designing your project was Parks and Gardens employees with disabilities and mental health issues feel more confident to interact with members of the public. The component we might look to measure is the level of confidence to interact, and it is the employees that we want to count here. Success might be represented by seeing an increase in the number of employees feeling confident. We also want to consider what data sources could be used. Now, employees feeling confident is not likely to exist in the current data source, but this could be collected by asking the employees about their feelings of confidence. This might be through a survey or interviewing these staff members. There could be a regular staff survey rolled out or interviews conducted through human resources reviews with employees. The second outcome example from our case study is the mental health and well-being of employees with disabilities and mental health issues improves. This is actually quite a broad and potentially long-term outcome to achieve, which may have many ways to measure success. One of the possible measures we propose here is the number of sick leave days taken by employees. This was mentioned in the description of the case study as one of the issues raised. Success might be represented by seeing a reduction in sick leave days taken. So in terms of a data source for this example measure, data could be sourced from the Council's existing administrative workforce data. It will be important to capture this measure at the start of the project and again throughout the project to assess whether a reduction is achieved over time. I want to explore the concept of time in relation to outcomes and measures. This diagram illustrates the time frame element related to our outcomes and when we might look to measure change. The red boxes here on the left represent the finite time frame of your Recovery Boost project, which might be up to 18 months. In the session on planning how to evaluate your project, we discussed elements of a program logic, which include inputs, activities, outputs, and outcomes. Your project will typically involve all of these elements, so they are represented here in the red boxes to the left. I've suggested that the outcomes are probably likely to be short-term in nature, given the Recovery Boost projects are relatively short in duration. The blue boxes here to the right represent potential ongoing sustainability of the project, where ongoing longer-term outcomes may eventuate beyond the red project timeframe. We recognise the area of mental health is complex and may in fact require much longer timeframes to see real impact on some outcomes. The grey measure boxes represent the points at which you might assess measures of success. The first one is potentially a baseline measure at the start of your project, to which repeated measures later on can be compared. This is just one way of illustrating that the timeframe of your project may allow measures of success that reflect short-term outcomes or incremental change towards longer-term outcomes. It is important to plan from the start how you want to measure success and when to collect and analyse the data. Here I'm just bringing in an illustrative example using our regional council case study. One of the example outcomes relates to employees with disabilities and mental health issues feel confident to interact with the public. The measure I've illustrated here is simply a proportion of employees who express feelings of confidence. The repeated measures can reflect success through an increasing proportion of those feeling confident over time. This might be an incremental increase in the short term within the time frame of the project, and could continue to be measured by the Council over longer term to assess ongoing success beyond the time frame of the project. The concept of sustainability might be captured through ongoing sharing of videos beyond the life of the project, and could even flow into other councils that might introduce similar projects themselves. So the population of employees we're looking at may actually be bigger in the longer term. So this is just one way of thinking about short-term and longer-term outcomes. There will be many more ways to look at the pathway that applies to your own projects. Now I want to touch on the methods that could be built into an evaluation plan relating to data collection and analysis. The case study examples we've introduced so far reflect a mixture of quantitative and qualitative data, all of which can help produce a complete understanding of a project. Let's look at a potential survey with staff or members of the public. Survey methods to consider. Describe who will be surveyed. How will you recruit them? And the mode of the survey could be online or in paper or in person. You need to design the questions to be asked, and this also requires some thinking about the likely answers and how to count or aggregate the results. Interactions might be reflected in categories or scales of positive to negative, or you might want people to describe in their own words the nature of the interactions. Perceptions, similarly, you can design questions to be answered in categories to count responses for a numeric measure. Or longer descriptions might need a qualitative approach to assessing common themes of different responses. Finally, describe how and when a survey will be conducted and analysed to assess success or change. Interviews with staff members. Again, you need to plan how to recruit your staff members to take part in an interview. Prepare the questions to be explored, which ideally will be consistent when repeated for multiple interviews. You can explore through interview discussions the nature of interactions, descriptions of the feelings and perceptions and reasons. Similarly, as for surveys, describe how and when these will be analysed in a qualitative way. Look for common themes that might reflect success. For example, the majority of employees reflected positive interactions. Finally, accessing existing administrative records. This is actually more complex than it sounds, particularly when data relates to people's personal information. There are likely to be ethical issues to address and privacy implications, for which there is strict legislation in Australia to protect people's privacy. You need to describe how to access or request de-identified data from the owner of the data source. In our case study example, this might be the HR department of the council. It might be reasonable for a report to be generated that provides total numbers of leave days in a period of time, but not by individual person. Identify data items that you want reported. For example, there are many types of leave, so you need to define that sick leave is the specific type you're interested in. Finally, you want to plan how you will analyse the data to reflect a change, which will hopefully reflect a reduction in sick leave over time in our example.
Now let's spend a minute talking about reporting. At the end of each project or evaluation, a report is typically required. There's a couple of things to remember when reporting on your project. Number one, is that it's important to write your report so that it is meaningful to the intended audience, in this case, Sarah. Number 2, no one size fits all. The content and the format of a report should be designed to suit the project and the intended audience. And number 3, the content of the report should bring together the methods you used and your findings, and the findings should relate back to the evaluation questions that are in your evaluation plan. You also need to include conclusions, and typically included is recommendations. These recommendations and conclusions should also be informed by your findings. A typical evaluation report content includes the executive summary, usually a 1 to 2 page summary, a full description of the project, your aims and evaluation questions, the evaluation methods that you used, and your findings, including outputs and outcomes, and then your conclusions and recommendations. And please remember that CIRA is trying to build the evidence base around workplace mental health, so a well-written report will be very, very important. The last slide in this session provides evaluation resources that are really excellent as you go forward with your project. These include the New South Wales Health Developing and Using Program Logics, a guide, the New South Wales Department of Premier and Cabinet Evaluation Toolkit, the Better Evaluation website, and the Australian Evaluation Society website.